Yeah, this is, I think, a very pertinent topic to discuss at the present time, because we have a lot of very intriguing data from single-arm studies or retrospective data to suggest that intensifying therapy using a combination of, whatever TKI plus IO combination is your preferred choice, can lead to improved outcomes for patients with metastatic papillary kidney cancer over what has been the standard of care for a while, TKI monotherapy. However, I think it's important to your question, I think it's important to understand that this new development or emphasis on doing combination therapy is grounded in combination or single-arm studies. So there's no direct comparison. Everything's compared to historic controls. And largely, the outcomes that we're looking at in those monotherapy trials are objective response rates, not overall survival. In part because it's really difficult or impossible to accurately measure overall survival in a single-arm study compared to a historic control. So the main arguments for doing TKI monotherapy is that we don't have comparative data to show that combinations are more effective. And we do know that combination therapies are more toxic, both financially. You're doubling the cost of the patient and the healthcare system by doing a combination therapy, but also, very, very importantly to the patient, their quality of life is significantly impacted by the addition of that TKI plus IO therapy. In part, if you think about it, the TKI and IO therapy, because we're not seeing synergistic activity with the two, you're continuing both of them for the entire duration of therapy for that patient. Which means even if the cancers become, for instance, resistant to the TKI, but is still responding to the IO, the patient is still receiving the toxicities for that entire duration. In contrast, if you do them sequentially, starting with a strategy of TKI monotherapy first, you're only exposing the patient to the TKI toxicities for that duration of time before you move on, switch therapy to their immune therapy treatment.